Hello, my name is Alison McLeod. I'm a physical exercise specialist for the Canadian Forces Support Unit Ottawa-Gatineau's reconditioning team. Today, I'll be talking to you about lower back pain. So let's get started. The objectives of this workshop is to briefly discuss the spine anatomy. Then we'll talk about causes of lower back pains and common back injuries. And then I'm going to show you a couple of lower back pain assessments that you can do at home. Here is a diagram of a spinal column. So you can see it's just a series of spinal segments stacked one on top of the other, starting with the cervical spine here, then the thoracic spine, beneath that is the lumbar spine, and then there's the sacrum and coccyx. For today's purposes, we will be discussing mostly the lumbar spine. Each spinal segment is made up of a body, a vertebral foramen. The vertebral foramen allows for the spinal cord to run all the way through from the brain down to the final segment of the spine. Then there's transverse and spinous processes, which allow for muscular attachment. This allows for movement or movement resistance in the spine. In the lumbar spine, there's the articular processes here, and what they do is they articulate with the segment above or below it. And underneath the spinous processes, there's the pars interarticularis. Between each spinal segment at the level of the body, there is a vertebral disc. As you can see here, here's the vertebral disc. It's between two segments. And what that does is allow for cushions between the spinal segments, and it allows for smooth movements and reduces pain or the presence of pain. The spinal discs, or rather intervertebral discs, consist of annulus fibrosus. This material around the outside edge, it's more fibrous and durable in material. And then in the middle of that, it's the nucleus pulposus. The consistency of that is similar to toothpaste. And a lot of people like to describe it almost like a jelly donut. So the nucleus pulposus is the jelly and the annulus fibrosus is the donut. So I took this chart from DTS's Low Back Pain Secrets because I feel like it has an important message. So what they did here is they took the spinal imaging of a bunch of different people and then they categorized them by age. Then they took a look at the image itself and they noted presence of different kinds of back injuries. So as you can see here, there's a list of back injuries. But what may seem weird is that there is presence of every common type of back injury in a 20-year-old and in a 30-year-old, but most people that age do not feel any pain, right? So when you're young, you can still have some disc bulge, some disc protrusions, and some degeneration, but you don't feel pain. What this means is what you see in an image isn't necessarily the cause of your pain. So if you go get your spine image and someone says, oh, I see this at this segment, you should be feeling pain when you do this, you can start to anticipate pain and almost create it for yourself by avoiding certain motions and not moving the way your body intended to. So now I'm going to discuss causes of lower back pain. It can consist of postures, motions, and loads. So poor postures over extended periods of time causes microstress to certain parts of the spinal segments, and after long periods of time, it can result in an injury and pain. So if you move with poor technique, the same thing can result, causing too much stress on certain parts of your spine, which can result in injury and pain. And then there's loads. So if you work with excessive training loads or inappropriate training loads, and you have poor training program or periodization, you can get an injury in your back and experience pain. What I mean by poor training programming is that you do not program in recovery. You do not allow your muscles and your joints and your spine, you do not allow for it to heal and recover between lifting. If you have any more questions about how to properly program, please speak to your PSP trainers. Any combination of postures, motions, and loads can result in back pain or injuries. Okay, here I have a list of common back injuries. We have disc bulges and herniations, vertebral end plate fractures, facet injuries, spondylolysis, and nerve pain. Nerve pain is usually the result of any or all of these injuries, but it could also result from muscle tension. All right, I have here an image of what a bulged and herniated disc looks like. So up top here, you can see a normal disc, right? The intervertebral disc is sitting between the body of two spinal segments, and it is providing ample cushion between the two of them. A bulging disc, as you can see here, is a little bit of the annulus, either pulposus or fibrosis, is protruding out the back. So what happens is usually this is a result of spending too much time in a flexed position. So the spine is flexed kind of the way my cursor is running, and all the pressure at the front of the intervertebral disc pushes the material backwards. And then this makes connection with the spinal column, and that kind of pressure can cause pain. A herniated disc is just this chronic pressure on the front of the intervertebral disc to the point where the annulus pulposus has completely protruded through the annulus fibrosis and is now sitting in the vertebral foramen and taking up the space of the spinal column. And this causes that nerve pain that I just previously discussed. Here I have end plate fracture and facet injury. Sorry, I'll move that. End plate fracture, you can see it there. Okay, end plate fracture is a fracture that occurs on the end plate, or rather the body of the spinal segment. As you can see, there's many ways that a fracture can occur. It can occur through the middle, it can kind of sprout out, it can go around the outside, or it can even go all the way through the edge. End plate fractures usually occur when there is a lot of compression forces on the spine and not enough recovery. So over here, we have a facet injury. You can get a facet injury almost the same way you can get an end plate fracture. But instead of the fracture occurring on the body of the spinal segment, it occurs where the facet articulates with the one below it. You can get a facet injury from a lot of compressive forces, but as well like twisting. So twisting and compressive forces under load can cause a facet injury. Spondylolysis. So the spinal processes in the lumbar spine is called the pars interarticularis. And if there's too much flexion or extension under load, usually flexion, it can cause a fracture in the pars interarticularis. As you can see here, it has fractured and is separated. This can further evolve to spondylolisthesis, which is when the spine, as you can see, is now almost translating forward, right? It is completely separated from this is the sacrum and the coccyx, and it is translating forward, and this can cause a lot of back pain. Low back pain comorbidities. I will further discuss exercises to help with these in the assessments, but right now I'll go over what they are. So usually back pain doesn't come by itself. When you experience back pain, you usually also experience gluteal amnesia. So gluteal amnesia is when your glutes don't properly activate to perform their action. For some reason, if there's an injury in your back, your glutes like to turn off or just down and not perform their actions or fire as strongly as they could when you were uninjured. This can cause more issues because you won't be moving properly and you won't be supporting your movements with your glutes, which are a very strong muscle. And then hip tightness. Once again, when you have lower back pain, your hips get tight to protect your lower back, but it kind of feeds into the lower back pain after some time. You experience more hip tightness, you put more pressure on your lower back, which leads to more hip tightness, and it all feeds one into the other. Like I said, in the assessment part of this workshop, I will show you some exercises to help reduce the gluteal amnesia and hip tightness that you may experience with lower back pain. So, rehabilitation goals. The goals for those of us who work with people with lower back pain is primarily we want to reduce pain, right? We want to help you return to activities of daily living without pain. We want to enhance stability. So enhancing stability will also help reduce pain because you will have more core strength and you will be able to control your postures, your motions, and your loads better. We want to restore hip mobility as previously discussed because it'll help relieve some of that tension experienced on your hip and your lower back, and it'll help reduce pain. We want to normalize movement patterns. We want to take a look at what movements cause the lower back pain, and we want to teach you how to properly move so that you don't get injured again or you do not feel that back pain. And we want to gradually progress back to activities. Our goal is to have you returning back to the life you had before you had back pain. So through these steps, we aim to do that. Okay, so when we're doing an assessment of someone with lower back pain, what are we looking for? We look for movement intolerances. So we ask people to flex their spine, extend their spine, sometimes rotate, and sometimes add load. And we're looking for what motion, posture, or load results in pain. Because from there, we can deduce where the injury may be, but also what we need to strengthen to reduce the pain. Okay, so you can do a little bit of your screening yourself before you go see any kind of healthcare practitioner so that you can better understand your back pain. So if you are experiencing back pain, ask yourself, are there any good days? Do you have back pain every single day, or are there some days where you don't have back pain? If so, take note of what you did in that day. Did you sit and watch TV a lot of the day and you experienced back pain? Or on a day that you were walking a lot, was your back pain alleviated? Take the time to notice patterns because this will help you in your rehabilitation. If you don't have any good days whatsoever, it is important that you go see a health practitioner because there could be something more sinister happening. All right, which motions usually result in pain? So a lot of people say when I bend forward, I feel pain. I bend to the side, I feel pain. So take note of those motions, but also pay attention if these motions are under load or if it's just body weight. What postures usually result in pain? So how you sit and also how you stand. That can have a big impact on your back health. And also, most importantly, what takes pain away? We're not talking about medication here. We're talking through postures, motions, and load. So what posture, what motion, and what load takes the pain away? Now we're going to move on to assessments that you can do so you can better understand your back pain. The first assessment we're going to do is a seated assessment. You're going to need a chair to do this. Sitting down, making sure your feet are flat on the ground. Try to sit up with a neutral spine, okay? We're gonna add a little bit of compression to that to see if you have any compression intolerance. To do so, you're gonna use your hands and grab on underneath the chair and pull. Do you feel any pain? If you do feel pain, you just tested positive for compression intolerance. Now we're going to assess flexion intolerance. Sit in the chair, slouch forward, round your back. Good. Your spine is now in a flexed position. Do you feel any pain? If not, great. If so, you already tested positive for flexion intolerance. But we're going to move it a little bit further. Grab your hands at the bottom of the chair, just like the neutral spine, and pull down. Do you feel any pain? If yes, you just tested positive for flexion intolerance. Now we're going to test extension tolerance. So now you're going to extend the spine, arch your back. Do you feel any pain? No? Good. If yes, you've already tested positive for extension intolerance, but now we're going to add a little bit of pressure onto the back. So use your hands to grab onto the side of the chair and pull down. Did you feel any pain? If so, you just tested positive for extension intolerance. So whether it was compression intolerance, extension intolerance, or flexion intolerance, if you tested positive, try to avoid having your spine in those postures, and you should go talk to a medical professional. The next assessment we're going to do is a front raise test. So you're going to stand, have a small load, so we have 5 pounds here, lift it up just to shoulder height and back down. Let's get another view of this from the side. Lift the weight up and back down. You notice how Steph stuck her hips out, right? So if you do that and you feel pain, let's try doing the lift a different way. Roll your shoulders back, brace your core, and make sure your spine stays neutral as you perform the rep. And back down. Did the pain decrease when you braced your core? If so, that shows us that you don't properly activate your core when you perform motions under load, and it would be a good thing to start adding to your daily activities to reduce your back pain. So while you're waiting to talk to a medical professional or waiting for a program to be made for you, here are some exercises you can do that are safe and will hopefully reduce some of the symptoms you're experiencing. The first exercise we're going to do is called the McGill sit-up. So what you're going to need to do is lay down on your back. Good. Have your hands by your side. One leg stays extended while the other one stays bent. Press your lower back into the ground, feeling your core brace. Keeping your chin away from your chest, lift your shoulder blades off the ground. Good. Just a little bit of a crunch and back down. You would repeat the same thing on the other side. If that's too easy, you can raise your heel off the ground just an inch or two. We don't want too much height. And then you perform the rep. Good. You perform reps on one side and then switch legs. So you extend the opposite leg and perform reps again. The next exercise we're going to do is called bird dog. You're going to need to be in a quadruped position on your hands and knees. Good. Make sure your shoulders are above your wrists, your hips are above your knees, and toes in the ready position, meaning that they're curled under. At the same time, you're going to extend opposite arm and leg out. When you're extending your legs, I want you to drag your toes on the ground and then just let them pop off, right? Full glute engagement, and your hips stay in line. They're not rocking back and forth. While you're doing that, you're going to extend your arm out. It's going to be at a 45-degree out, thumb pointing up to the ceiling. You should feel your glute and your back activating. And then you come back down to the quadruped position and perform the same thing, opposite arm and leg. Good. If your core is braced, you should feel quite stable and your hips won't roll around. The next exercise is a side plank. So you can perform this from your knees or from your feet. You're going to start on your side, squeeze your glutes, and lift off the ground, feeling your core, your obliques working. Take nice long deep breaths, and then you perform the same thing on the other side. The next exercise we're going to do is the glute bridge. We're going back onto our backs, making sure your core is braced, your feet firmly planted into the ground. Press down to the ground with your feet to lift your hips up. You should feel your glutes activating to do so. Notice how it's a nice straight line from her shoulders to her knees. She's not overarching, but she's not also underarching. If this is too easy, what you can do is one leg at a time, right? So she has her right leg lifted and she's pressing with her left, maintaining that same height, back down, and same thing with the other leg. Good. If you feel this in your hamstrings, try to tuck your feet a little bit closer to your glutes. Perfect. And the last exercise is more of a mobility exercise. We're working on our thoracic rotation, or the ability of our mid-back to rotate. Laying on your side with your knees tucked in, hands are stacked one over the other. You're going to trace your thumb up and over your head till you open up all the way into almost a T. If you feel a nice stretch in your pecs partway through, you can stop and take a couple breaths there, but then finish your rep. And once you're done, you return back to starting position and repeat. If you're not able to get your hands all the way down on the other side, that's okay. Just sit there and let gravity do your work, and make sure you repeat on the other side. So you start rolled over the other direction. Thank you for taking the time to watch my workshop today. Have a great day.